If I have a young woman with small, perky breasts, I put in an implant. Everyone knows there's no need for a lift. If the nipples are pointing down, you need to do a lift for sure. The question is the in-between breast. The breast where the nipples are a little bit low, there's some loss of fullness of the breast up top, and there's some bottoming out below. Based on judgment and experience, I have to decide whether or not to do a lift. When you do a lift, at the minimum, you're talking about a scar around the areola. Periareolar lifts sometimes widen. The scars can be thicker and raised, and I'm not a big fan of them. A circumvertical lift, which is a scar around the nipple and a vertical line, or so-called lollipop lift, that's my favorite technique. And even though there is, again, a scar around the nipple, the biomechanics of how the wounds heal are different, so those periareolar scars tend to heal quite nicely, and the vertical scars fade a lot. There are some times where I'm not sure if a patient needs a lift, and I'll have a discussion with them. And what I usually recommend in those cases is I say, look, let me do the dual plane technique, and let's look at your breasts in 6 months, because I know with the dual plane technique, that implant's going to come down, fill out the lower breast, push the nipple forward, and get it to come up a little bit. And so far, I've yet to have to go back on any of those patients and do a lift.